It all began here, the party city of the Persian Gulf, Dubai. As many countries tightened lockdowns on the eve of the new year, Dubai opened its borders to flocks of tourists coming from across the world, branding itself as a sunny, quarantine-free escape hatch. Football stars, actors, and influencers, along with thousands of ordinary people, flew to the tourist hub to spend the holiday period there. The world's most open city during the coronavirus pandemic provided these travelers and revelers with a bolthole, where they could enjoy five-star hotels and restaurants, crowded bars, accessible beaches, and other social activities banned in their home countries. No doubt, the large influx of rich tourists to Dubai brought an economic boost to its moribund economy. But soon, the party city had to pay a hefty price for it.
الحادث اللي حدث مؤلم جدا لجميع السعوديين.
Hard hit by months of lockdowns, Dubai finally decided to adopt easier entry requirements for foreign visitors. At the same time, the UAE authorities assured the public at home and abroad that they could handle the pandemic in the best way possible. In the words of Alawi Al-Sheikh Ali, Deputy Director of the Dubai Health Authority, the approach in the UAE and in Dubai in particular has always been underpinned by science and science-informed common sense.
When you see that specifically tourism has taken such a massive hit in 2020, this is a great danger for Dubai in particular, because Dubai has been reprofiling itself as a tourist destination for the last couple of years. The UAE has been slightly more forward-looking than, for example, Saudi Arabia in understanding that a petroleum-based economy is not viable for the future. And as such, they have been trying to reposition themselves in the global economy in different ways. For example, the banking sector, as well as the entertainment industry and the tourism industry and the luxury tourism industry in particular. So when COVID happened and struck the world, this was a massive threat for the stability of this, let's call it what it is, this artificial creation that is the United Arab Emirates and Dubai in particular. So I think that's why Dubai has decided to look only at it from an economical point of view, without really looking at the possible nefarious consequences that it could have for itself as well as for the world.
In December, hotel occupancy in Dubai rose to an average 71%, according to data provider STR, reaching more than 90% at beach locations. Figures from the UK Civil Aviation Authority show nearly 300,000 people traveled between the UK and the UAE during November and December last year alone. Moreover, it means the total number of travelers should be much higher. But hospitals began to bear the brunt of this economic revival. In late November, active coronavirus cases reached about 25,000, while the number hovered at around 2,000 in early November, just before the tourism season started. In other words, COVID-19 cases have quadrupled since November to almost 4,000 a day.
A rise in sickness and even in deaths might be considered a worthy sacrifice in order to keep the economy going. It's a very bleak way of looking at things, but I think it is not too far-fetched to think that there are people, especially those in power, who are thinking that way, not exclusively in the UAE, but also, across the West in particular. And I think this is what has happened here. The idea that the chugging along of the Emirati economy, the continuation of the expat immigration and emigration to and from Dubai, which is the beating heart of the Emirati economy. About 85% of the population is consisted of foreigners. That the coming in and coming out of expatriates and the coming in and coming out of tourists was considered to be their prime and most important goal, and not so much the safekeeping of the public health.
Financial Times has recently released a report which shows the gravity of the situation in Dubai. A doctor tells the Financial Times journalist that the combination of case volume and severity has smacked government facilities hard, adding that Abu Dhabi is asking private sector hospitals to give a hand with the raging pandemic. Another doctor says the New Year shenanigans in Dubai were an obvious super spreader event. After that, cases have gone up quickly, and we have the new variant too. Another expatriate doctor reveals everyone is trying to make extra space, as most places are almost full. There is a big shortage, as lots of infected people are coming through.
The idea that you could have over 300,000 positive cases in a population of just over 3 million is a massive problem. This is it's a scandal that something like this could happen, especially in a country that is incredibly rich and definitely has the potential to contact trace, to test and to contain and to quarantine. This is it is good to see, of course, that the Emirati government is taking some actions now, and they are shutting down pubs and gatherings and parties and stuff like that. But this is something that should have been done months ago, and in fact, in most of the world, it has been done months ago. There are countries in which no public gatherings have been allowed for almost a year now, and those countries are often the ones that have done the best in stopping the pandemic. So the fact that the UAE, Dubai in particular, opened up in July again and had this massive surge in December, pretending like nothing was the matter, that nothing was going on, is absolutely ludicrous. It's absolutely scandalous.
Meanwhile, the UAE Health Ministry is urgently advertising for nurses to work in Dubai and other Emirates at higher salaries. That said, hotels, bars, beaches, and shopping centers are still crowded. In spite of what the Emirati authorities have promised to do in order to cope with the resurgence of the pandemic, images of busy beaches and Instagram celebrities without masks draw a dreadful image of carelessness in the face of a deadly virus. According to Aaron Bromwich, a professor of biology at the University of Massachusetts Dartmouth, they have brought the virus in, including the new variants, in waves of new tourists, and allowed it to spread through the community as well as spread to uninfected tourists. The tourists returned home and seeded infections there, possibly the new variants. Now, Dubai has unwillingly transformed from a tourist center into the COVID-19 super spreader capital of the world. According to the Associated Press, more than 900 Israeli travelers returning from Dubai have been infected with coronavirus, and the returnees have created a chain of infections numbering more than 4,000 people. Meanwhile, Denmark has discovered one traveler coming from Dubai positive for the South African variant of COVID-19. The Filipino authorities say they have identified a traveler who had made a trip to Dubai in December with a British strain.
We can look at the numbers in Dubai, which are horrible, the numbers of COVID cases that exist in Dubai right now. But that does not even show the extent, and it's very hard, of course, to really calculate that, the extent in which Dubai has helped spread COVID to other countries. And this is something in which you see Dubai acting as an extreme version of a Western capitalist nation, in which we see that in Europe as well, that a lot of governments have tried to lift lockdowns prematurely, have tried to lift restrictions prematurely because they said, what about the economy, without thinking about what about the human cost if you lift things prematurely and allow the virus to fester more. Now, Dubai is not a Western power, but they are basically, I like calling them a Western capitalist power in extreme variety, because they are trying to catch up so quickly to the development of, let's say, the Western capitalist imperialist world, that they are really throwing away all caution into the wind. And this is what we see, the consequences of that is what we see now.
By opening its borders to revelers and partygoers during the festive period, Dubai didn't find a panacea for its economic problems, but did certainly open a Pandora's box, which could complicate the global health dilemma even further.
والله يا أنهم كفوا الجنود وعينهم على جزيرة العرب